Welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS 4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about health issues here on CBS4Denver.com. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we're going to do our best to answer those questions. In today's chat, we're going to discuss weight loss surgery. Are you 100 pounds or more above your ideal weight? Have you failed at cutting back or calorie counting? Have you been to Weight Watchers, The Zone, and South Beach, and still the scale won't budge? Is your weight now endangering your health? Joining me today is Dr.Doru Georgescu, Medical Director of the Weight Loss Surgery Program at North Suburban Medical Center, and Dr. Stacy Perlman, who specializes in bariatric surgery and helped develop the Teen Obesity Weight Loss Program at Rose Medical Center. Okay, doctors, let's talk first about the problems associated with obesity. Let's take a look at the list. We all know, we've heard it a million times, obesity could lead to heart disease. That's one of the first things we talk about. Also, type 2 diabetes we hear about. Asthma, something else, another obesity risk. Sleep apnea, which can be very serious. And social discrimination, let's face it. You get ridiculed, people are like, whoa, what's wrong with that person? You know, and there's all sorts of problems. First question that people have, is surgery the best answer?
I think that probably it's correct to say that nowadays surgery is the best answer. And let's analyze why we say this. What are the alternatives? We have diet, exercise, behavior modification. All these methods have been tried for many years, and actually we have probably hundreds of diets there. Why do we have so many? Because none of them is the best. These are not bad alternatives. I think that they are efficient in a certain degree. The problem with them is the lasting effect. People are able to lose 50, 70, 100 pounds sometimes with these methods. But 90 to 95% of the people, statistically, regain weight within the next 5 years. So if you compare with surgery, which is not perfect, which also has some limitations, but the results of surgery are much, much long-lasting. In more than 10 years after the surgery, only 15–20% of people could regain some degree of weight. So if you look at this comparison, I think that obvious surgery, although not perfect, is by far the best answer that we have nowadays.
Sure.
We hope that the magic pill is going to come. And
I'm waiting for that myself. Wouldn't you like to be your ideal weight forever? Not have to worry about it? That would be really nice.
Yes.
Dr. Perlman, your thoughts on that? Is surgery always the best option?
I think it depends on where you're coming from. So it always is going to depend on your starting weight. If you have 20 pounds to lose, if you have 15 pounds to lose, absolutely we wouldn't recommend that in that situation. This is really for people who have 100 pounds to lose, whose body mass index is greater than 35, someone who we are really going to be able to help with a reduction in comorbidities, getting their blood pressure under control, getting their diabetes under control. We really want to make sure that we're focusing on the population that we can really do more than just a little bit of cosmetic assistance for, that we can really make a change in their quality of life and their health.
So again, we are talking about someone who is obese.
Exactly.
Okay. So we talked to you a little bit about who qualifies for weight loss surgery. Would you add to that?
I think that the only thing that I want to add is that nowadays we try to even ask ourselves and scrutinize the concept that was established in 1998 by National Institute of Health, which says that surgery should be done in people who have a BMI above 35 and comorbidities above 40 and so on, all these criteria that we discussed probably in the past. The question is, why should we wait until somebody has a BMI above 35? What not doing earlier when we know that actually people who have a BMI above 30 have significant increase of comorbidities? It's almost 400% increase in diabetes and 75% increase in coronary artery disease at a BMI of 30. Why not do it at that time? So actually there are multiple centers across the world, and I think that even you have a center in Rose in which they try to reevaluate this, and under specific circumstances, we try to offer the type of weight loss surgery, again, in the specific criteria, to people who have a BMI below 30. Below 35.
Right.
It is not well established. It is not approved by the majority of the insurance companies and so on. Is not actually accepted by the general community. But it's clearly a trend to lower the entry point into the weight loss surgery to a BMI above 30, where it actually is the level of obesity.
But some would argue they need to change their minds. They need to change their lifestyle before we worry about surgery and give them that quick fix. You don't agree?
That is 100% correct. Actually, one of the criteria, which I think that should remain always, is that we don't offer the surgery to people who haven't tried to lose weight with a less aggressive method. Because think about, there are that 5–10%.
Right.
They may actually be successful, particularly when the BMI is lower. You definitely have to try a less aggressive method. Surgery is pretty safe, but still is a surgery. So I think that you should leave it as a last resort.
Okay.
Right.
And what about for a teen? When you talk about a teen, a lot of people would say, ugh, you want to put a teen under the knife, you want to do surgery with a teen? I don't know if I like that idea.
Right, and it's certainly a very controversial issue, but look at what you're exposing the teen to on the other side. You're looking at, someone who's going to be developing diabetes. Children are developing diabetes at age 2 and 3 now, and that's the first time we're seeing that in this generation. They're guessing that about a third of our toddlers are going to end up with diabetes at some point in their lifetimes, which is terrifying to me. So we're exposing them to this lifestyle that is not going to be pleasant for them at all. We're exposing them to ridicule. We're condemning them, in a sense, to a life at a lower income, less likely to go to college, less likely to get married. Are the benefits worth, the benefits of waiting worth the risks of waiting?
So
and we feel not.
I just have to back up just a little bit. So have we created this situation? I mean, what happened to eating correctly, knowing what your correct weight should be, trying to live a healthy lifestyle? Have we just thrown that out the window and anything goes, and that's why we're at this point? I wonder, yeah.
No one has time for that anymore. We're rushing to and fro. We're going in so many directions. We are eating convenience foods. We're eating fast foods. We're driving to places. Our kids don't have safe places to play in a lot of areas. So, our options are limited. And especially with low income and some of the difficulties with economics right now, people are buying less expensive food, which, as we know, is less healthy food. And they're exercising less because the TV is a great babysitter.